Shedrack and his drama troupe. That's from the Taraba State Art Council. We are now going to, please, a round of applause for as the mother of the nation comes up to give her goodwill message and the formal launch.
Thank you very much. Can we be seated? Thank you very much. The wife of the Vice President of the Federal Republic of Nigeria, Her Excellency Hajia Nana Shetima, and also the Vice Chairman of the Renewed Hope Initiative, the Governor of Taraba State, His Excellency Dr. Agu Kefas, and his wife, the First Lady of Taraba State, Her Excellency Mrs. Agu Kefas, the star boy and the star girl of Taraba State, First Ladies of other states here present, wives of National Assembly members here present, the Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, CON, wives of Honorable Ministers here present, the Speaker of the Taraba State House of Assembly, Right Honorable John Kizito Bonzena, and other members here present, members of the Taraba State Executive Council, wife of the National Security Advisor to Mr. President, Hajia Zara Ribadu, wife of the Chief of Defense Staff, Mrs. Ogogo Musa, wife of the Inspector General of Police, Mrs. Elizabeth Egbetokun, wife of DG DSS, Mrs. Charity Ajayi, wife of the Comptroller General of the Nigerian Customs Service, Mrs. Kike Lomadeni, the APC Deputy National Woman Leader, Hajia Zainab Abubakar Ibrahim. We represent our APC chairman in Taraba and also the PDP chairman in Taraba as well. The National President of the National Council for Women's Societies, Mrs. Princess Edna Azura, the Executive Director, CEO, National Primary Healthcare Development Agency, Dr. Muyi Aino, development partners present, including WHO Country Representative, Dr. Walter Kazadi Mulumbo, Director General of NACA, Dr. Timitokpe Ilori, UNAIDS Country Director, Dr. Leo Zekeng, and National Coordinator, NASCAP, Adebobola Bashoro, nurses and midwives, market leaders and market men and women present, our dear students, youth, and the NYC members here present. Great Nigerian youth, great Nigerian youth, great Nigerian youth. They say, God bless you. Our dear strong and brave survivors present, gentlemen of the press, distinguished ladies and gentlemen. You see, I took my time to do the introduction. This campaign is meant for every Nigerian, despite we are doing the triple elimination campaign. But I want every Nigerian, no matter the segment. You can see we have wives of service chiefs. They have also a lot of women under them. We have market women and men in the market, traditional rulers, religious leaders. But most especially, this campaign is meant for our children and youth, which you can see that the country rep for UNAIDS was able to expatiate on why it involves you. But I'm honored to officially launch the Free to Shine campaign in Taraba State as I conclude my 2-day working visit to the state. The Free to Shine campaign is an advocacy initiative led by the African Union, the Organization of the African First Ladies for Development, OAFLAD, and global partners. The goal of this campaign is to address the growing complacency in the response to the spread of HIV/AIDS in Africa. Nigeria being the country with the highest burden of HIV/AIDS in sub-Saharan Africa due to its large population, faces significant challenges. You heard today that Botswana is free. Botswana only has a population of 2.something million. But Nigeria, we have a lot of people affected because of the size of our population. And if we don't quickly address it, we will just have a lot of young people either dying early or just very weak for the legacy that is going to be bequeathed to you. So we want you to listen, very much. During my growing up years, HIV/AIDS, I could hear the music you were playing, which was Michael Jackson, We Are the World, is to raise money for HIV victims across the world. It was so bad during that time that even up till now, if I go for testing, my routine check, I still put HIV/AIDS there. Hepatitis B, I've already taken my vaccine, the shot for it. And a lot of things you have to check yourself continuously, even including all the cancers you want to do, mammogram, and a lot of things that can really affect any healthy living. So we want you, I don't know, a little bit disconnected from especially children in, our children in secondary schools. And, but I don't know whether they are doing that for you. And that's why all the state first ladies are here. Because what they are supposed to do, when I started nationally, they're supposed to go back to their states and let it trickle down, even to wives of local government chairmen. So I'm so glad that you are all here. And this particular burden we are talking about is very severe among children, youth, women, and marginalized groups. Because when you hear mother-to-child transmission, the men too are affected. When you hear our survivors' story today, you will see their husbands are passed. But I don't know why, but I believe that our men are also in denial. In Zimbabwe, when we went for ICASA, I see when the First Lady was talking to the men, there were quite a lot of them in denial. So, but this involves both the women and the men. I hope we have that clear. Okay, but our campaign, Free to Shine, is, and the testing more, is mother to child that I was speaking to Professor Pate earlier. They said they are still concentrating on mother to child transmission more, not that they are not treating the people who are infected with HIV/AIDS. So this, if we live very careful lives and make sure that even we are not, it's not only sexually that you transmit HIV/AIDS, exchange of needles, and also, sharp objects, people can get infected. To complement the Free to Shine campaign, I've also decided to advocate for the triple elimination of HIV/AIDS, syphilis, and hepatitis by 2030. This campaign will cover the 6 geopolitical zones of the nation. We launched the maiden edition campaign for the North Central in Kwara State on the 30th January 2025, and that of the Northwest zone in Kaduna in 25th February 2025, and South-South on 26th March 2025 in Delta State. Today we are flagging off the campaign in Taraba State for the Northeast zones. By the grace of God, the next zone to benefit will be the Southwest in Ondo State this month. So, and the Free to Shine campaign seeks to significantly reduce HIV infections among women of reproductive age, prevent mother-to-child transmission, which is the vertical transmission, and ensure that every child born with HIV receives the necessary treatment and support to thrive. According to the Federal Ministry of Health and Social Welfare, in 2024, there were over 100,000 children and nearly 2 million adults living with HIV/AIDS. Also, it is reported that most infants born to HIV-positive mothers are not tested within the first 2 months of birth, largely due to the fact that the mothers are not aware or they are ignorant of the consequences of their inaction. It is heartbreaking to know that just 2 years ago, 15,000 children ages 0 to 14 lost their lives to HIV-related illnesses. Each of these children was not just a statistic, but represented a future full of potential that was sadly cut short. The ongoing challenges faced by these children emphasize the urgent need for sustained action to improve prevention strategies, enhance diagnosis, and expand access to treatment. In Nigeria, hepatitis and syphilis are major public health concerns. Experts alight that hepatitis, especially hepatitis B and C, pose a significant threat as it can lead to chronic liver diseases and even liver cancer. If syphilis is left untreated, it can result in miscarriages, stillbirth, congenital abnormalities, and neonatal and infant deaths, among other complications. The goal of this campaign is to raise awareness, renew our commitment, and take collective action against these diseases. This, I believe, aligns with our shared vision of a healthier Nigeria where every individual, particularly women, youth, and children, can thrive and live healthier lives. This vision is in line with the Renewed Hope agenda on His Excellency President Bola Ahmed Tinubu GCFR, which focuses on health as an essential pillar of development. Nigeria is at the pivotal stage in a fight against HIV/AIDS and is poised and ready to join other countries in Africa who have achieved the UNAIDS 95-95-95 target by 2030. The aim of this target is to see that 95% of the people who are living with HIV/AIDS know their status. 95% of those who are aware of their status are placed on life-saving antiretroviral treatment, and 95% of these people undergo treatment and achieve viral suppression, which means they cannot transmit the virus to others. We must deepen engagement with traditional and faith-based institutions to address cultural and religious influences on HIV prevention behaviors, especially those engaging in birth services, by expanding access to HIV testing services with comprehensive counseling, treatment, and care for all individuals who test positive. I want to commend the members of the Association of People Living with HIV/AIDS in Taraba for their testimonies. Their stories serve as a powerful reminder of resilience and hope, inspiring others living with HIV/AIDS to seek the support and treatment they deserve with courage and confidence. I thank all our health workers and National Agency for Control of AIDS, NACA, National AIDS and STDs Control Program, NASCAP, as well as research and public health institutions for their efforts in combating HIV, AIDS, syphilis, and hepatitis through the years, as well as our global partners helping us in this fight. I especially recognize WHO, UNAIDS, UNICEF, UNDP, PEPFAR, and Elizabeth Glacier Pediatric AIDS Foundation, amongst others. I'm mentioning all these international donors because they used to assist before Trump came into power. So, but I believe that it will see reason before long. But if not, Nigeria is stepping up, and our political will is very strong. So we thank God for that. We must intensify efforts to ensure that the global triple elimination target of HIV/AIDS, syphilis, and hepatitis is achieved by 2030. I believe with the concerted efforts of all our stakeholders here present, especially our state first ladies, who will help disseminate this message in their various states, this deadline can be attained by the grace of God, and I rely on you all to do the needful. Also, the wives of our service chiefs, you have a lot of women across the nation, and I know you are working on that already, but we can intensify our efforts to to our dear children, and also market men and women. If you see pregnant women, get them tested. So it's very, very important. To our dear children and youth, this campaign cannot succeed without your involvement. You represent our future, our generation. However, your age group is one of the most vulnerable. Please take care and protect yourselves. We have increased our advocacy in the media across all 36 states and the Federal Capital Territory, and we hope it resonates. So First Ladies, you know, it's like we are paying forward. I've already committed you. You have to do that in your state. You see what I'm doing in Abuja? Please, we want you to step up. It's very, very important and very crucial for this campaign. Finally, I would like to express my gratitude to the Governor of Taraba State, His Excellency Dr. Kefas, and the First Lady, Her Excellency Mrs. Agin Kefas, and the good people of Taraba State for the warm reception and kind hospitality throughout our stay. The star boy and star girl, you know, we're quite impressed, especially this morning that we went as an educationist. I'm quite impressed with going there to, you know, to flag off your free education campaign, and also all the products you bought for your schools, and also the health program with the mobile clinic. And like I promised, we promised you one. We've already placed the order. So by Monday, we'll be making payment. So God bless our children, youth, and mothers. God bless Taraba State. God bless the Federal Republic of Nigeria. Thank you very much.
Thank you. Thank you, Your Excellency. Thank you. So next is for the records.
You are welcome to Taraba.
Yes, next is the photo session, please, ladies and gentlemen, to join Her Excellency on stage for